This is a short video called How Long Does a Pinched Nerve Last For? Now this comes as a response of a question that a young lady I've started looking after, who we'll name Kiara, and we'll name her that because that's her name. We've recently started looking after this girl, and pain's changed significantly and sort of moved into the lower part of her neck, which she feels is a pinched nerve, which a lot of people will think of that sort of pain as being a pinched nerve. And typically it's not really a pinched nerve. It's you've got a joint that's not moving properly, and that starts to create some inflammation. Then your brain picks up on this, so then there's some muscle splinting around the area. Ultimately it hurts and feels horrible, which most of the time people will think of as being a pinched nerve. Now, how long does that pain last for? Look, that really is one of those how long's a piece of string type problems. Now, if we don't do anything to that joint, we don't try and restore its biomechanics, it will potentially never resolve. Your brain can only do so much to get those joints moving again, and if it can't get them to move again, then it's not. It'll stop moving. Those discs that are in our spine, they don't get a direct blood supply going into them. They get their nutrition in and their waste out by squishing around. So when that becomes jammed up, they can't move properly, and the whole thing starts to thin down. We call it degeneration or arthritis, or just a crappy part of your spine. So from that point of view, it may never get better. In terms of the pain, that will most of the time absolutely get better. All right, now our brains are very good at getting used to things. And my favorite analogy for this is a little bit yucky, but if you go to the toilet and do something in there that's fairly unpleasant, for about 15 seconds, your brain is going, oh my God, that is disgusting. And then it's gone away. It stops smelling. Now there's still stink floating around. It's just your brain has kind of blended it into the rest of the stimulus that it gets. Now the next guy who walks into the toilet, his brain hasn't become accustomed to that. So for the next guy who walks in, it's pretty horrendous. But the same thing can happen with pain in our bodies. It doesn't take 15 seconds though, it often takes some time, but eventually your brain will go, look, it appears we can't do much about this. We'll make this pain part of our background noise, and you just accept it as normal. Now often then that joint isn't moving particularly well and is becoming less healthy, so it's less able to roll with the punches. If you step off a curb awkwardly, it's that joint that's going to go every time you do that. But so eventually with these sorts of things, the pain does go away, but you are best to see someone who knows what they're doing. I'm pretty good at this, but lots of other folk are too. Firstly, to work out that the joints are normal, you don't have some other horrible thing that's predisposed this pinched nerve that you've now got, and get it seen to so you can continue to enjoy life. See ya.